So just a query from the medical point of view.
Yes.
What I have noticed is earlier it used to be that we would wait for 3 to 5 days for the
Right.
symptoms to maybe become more prominent for some localization.
Right.
But what we are noticing now is that even then we are not able to identify the cause.
True.
And
True.
therefore, whether is it justified to order investigation on the 0 to 24 hours, the first day itself,
Right.
especially the specialized investigation like malaria
Correct.
and dengue.
Correct.
Is there any logic or flow chart?
So there is no flow chart as such, but I would put it across like in a way that what is the severity of the symptoms that the patient is having. Like when you have the monsoon months, I don't think there is any point of waiting for 2 or 3 days because it is going to be one of these 4 or 5 illnesses.
Correct.
Okay, so what we do is typically as practitioners, we would be prescribing a CBC when we are looking at the hemoglobin, we are looking at the white cell count, the platelet count, which is very important, right? And we are looking and trying to identify what kind of infection it is. It is just a plain viral, or if there is a drop in platelet count, maybe dengue, right? Something like that. Or if there's a drop in the WBC count, maybe your typhoid fever. Okay, so we are looking at the CBC report, and along with that, we are also ordering a CRP, okay, or an ESR to see if the CRP is elevated, how high the ESR is, and probably trying and judge if the cause is again bacterial or viral. Okay. In addition to this, now the trend is that the 4 main investigations, okay, which are available. So like malaria, okay, so MP has to be done along with the CBC, right? You have to do chikungunya if there is a joint pain, a chikungunya PCR.
Correct.
Okay, a dengue antigen, as I mentioned earlier. Urine routine to look for urinary tract infection if there is a burning urination or burning micturition, right? And in addition to that, we also look at the general parameters, like you would like to have one enzyme from the liver like SGPT to see if there is any damage to the liver happening. Okay, you would like to know baseline status of your kidneys with the creatinine test. So these are the few first line investigations which you would like to do depending on what season this fever is happening in. Now, if the patient presents with only fever, okay, and all of these are not positive, or you're not able to find anything in this, then probably the next line of action would be a chest X-ray to look for a lower respiratory tract infection or a pneumonia. Okay. Again, if there's going to be an upper respiratory tract infection, I don't think there's any need to investigate unless you have a very high fever.
True.
So, this is how it usually goes in the first week of fevers,